We have reported on how the pandemic caused severe burnout to healthcare workers, and many left the field. As the profession rebuilds and tries to draw new workers, our senior health correspondent, Monica Robbins, has news tonight of a company on the hunt and ready to hire.
We expect our doctors to give us their full attention, but every patient requires quite a bit of paperwork.
Clinical documentation is incredibly difficult. You ask a physician why they don't want to do it, it's because it's challenging and it takes them away from the patient.
Scribe America is one of the largest providers of medical scribes in the nation. They're recruiting at our local college campuses, finding applicants who can give doctors a break.
These scribes are saving 2 to 3 hours a night for these physicians so they can go home and actually have a personal life and not be, scrambling after hours to remember what they did that day while they're seeing patients.
Most applicants are between age 20 and 26, and they don't have to be pre-med.
They could be biology, chemistry majors, PhDs actually make really great scribes.
But for those considering a career in nursing or becoming a physician,
medical scribes is a great way to get your foot in the door with what it's like working in healthcare, particularly clinically.
Scribe America provides a paid month of training specific to the provider's needs, and the hours are flexible.
You can be not only in person in the ED in the Cleveland Clinic, but you also could be remote working from a dorm room, connecting to a primary care physician that works at, University Hospital.
A scribe enters everything into the patient's medical record, the doctor reviews and signs off.
It's almost like a personal productivity assistant for these physicians. And there's that collegiality of the role as well, where they're almost getting like a mentor out of this relationship.
So it is not an easy job. Being a medical scribe has its own share of burnout too. So it's a very transient business. The Cleveland market starts at about $15 an hour, but pay may depend on where you get assigned and where you are working.
We've discussed this. It's not only the medical community, but many businesses out there having the same problem.
Absolutely, yeah. But this is something they're trying to get college kids to do this rather than going to deliver food or work somewhere else. So.
Yeah.
News we can all use.
Totally.
Monica, thanks.
Yes, thanks.